Welcome back to our series on getting started with your virtual pelvic health practice. And today we're going to talk all about the importance of protecting yourself and your business. So in our last couple of videos, we talked more about like the intro of what it looks like to get started, as well as the legal setup for your business so that you can confidently know that you are functioning as a legal business entity in the eyes of both the federal and state governments. So like I said, today is more about that protect aspect. So making sure that you as the practice owner and your business itself are protected in case anything arises that requires you to take action in order to protect yourself and your license and your business. First thing that I want to discuss is the concept of liability insurance. Now, if you have been practicing in the clinical setting prior to starting your practice, you're probably familiar with liability insurance or malpractice insurance. And in the clinic setting, most often your employer will be the one to provide you with your liability insurance. Some employers require you to pay for it, but oftentimes they have like a standard liability insurance that they use or go through as like a group insurance, which can get you some discounts. I know that when I was working in my last clinic, the liability insurance that they went through was HPSO, but we just had to pay our yearly fees for it. And I think they reimbursed us. I can't remember, but they had like a group policy, which helped all of the clinicians get a discount on their liability insurance. If you don't know this, liability insurance protects us in different situations that could arise. It protects us as far as like legal fees go, our license, if we have misconduct, damages to property, and helps with any just like legal things that potentially may come up during our time as a practice owner against us or our business. And I would encourage you to do some research on the different types of liability insurance providers. Some common ones, like I said, include HPSO, CM&F, My PT Insurance, and then I'm sure there's like tons more out there. But I would encourage you to get a quote from each of these liability insurance providers and look at the different coverages that they offer based on the quotes that they give you, and then even contact them to discuss the potential coverage that you would need for you and your business. These people are the experts in providing liability insurance, so they should be able to give you a decent idea of what you may need to make sure that you're protected. Moving on to our next concept of protecting yourself and your practice, that would be creating consent forms. So in the clinic, typically when we're working for an employer, they have all these things lined out for us. We don't have to worry about it. Front office takes care a lot of times of when the patient comes in for their evaluation. They're given the paperwork that they need to fill out, including the consent to treat form. And so we also need that as private practice owners to make sure that we are covering ourselves. So within these consent forms, we need to include things like obviously consent to treat, what our privacy policies are, our cancellation policies, our payment policies, possibly a photo or video consent if you're going to be using different photos and videos of your clients for like your marketing. And then I would also encourage you to add something in there about PHI disclosure, just in case like of emergency, you need to disclose their personal medical history to another provider or whatever situation like that arises. And then make sure that you get their name, their signature on this form, and then the date that they signed it. And personally, like as a provider starting your own practice, I would encourage you to take advantage of Google Forms. Most people are familiar with using Google and the Google products like Docs, Sheets, Forms, and it's super simple to create a form in Google Forms, but that's where you would create this consent form and then have your client fill it out prior to seeing them for their first session. And then the last concept or the last thing that we need to make sure that we have in order to protect us and our business include intake forms. And these are maybe a little bit less emergent or less concerning to make sure that we get taken care of. But as a clinician, it is very helpful for us to at least have an idea of what the patient's coming in for before we see them, especially like as far as like protecting ourselves and our licenses and making sure that the patient is within the scope of practice that we offer, including things like red flag questions and that kind of thing to screen out any potential things that we need to be referring out to a medical doctor. But within these intake forms, you can really include as much or as little as you want to, or you should include, would be like their name and contact information, as well as their emergency contact in case something happens. You need to call this contact for the patient. Some other things that you can have within this intake form would be past medical history, their social history, are they married, do they smoke? Like I said, those red flag questions just to screen out anything serious that we would need to immediately refer them out to a medical doctor. And then you could also include more holistic questions that include things like their stress levels, their sleep habits, their nutrition, and then make sure to include a section that allows them to spell out what their goals for coming to see you are. Why are they coming to see you? What are they hoping to gain out of this experience? forms just to give you an idea of what that patient is hoping for. And like I said, you can include as much or as little within these intake forms as you want to. I know that a lot of therapists feel the most comfortable when they have the most information possible prior to going into an evaluation. Personally, I feel like when I was in the clinic, I would kind of skim over these things, make sure there was no red flags within the intake form, and then I practiced best just sitting down with the patient, taking their subjective, and then like going from there. Obviously, your intake forms are important, especially as a pelvic health provider. You want to know things like how many like babies have they birthed, were they vaginal, were they C-section, have they had a hysterectomy, different things like that specific to pelvic health, because I feel like those things give you a little bit of insight as to like what they've experienced, what their body's been through. But for the most part, I think like if you're comfortable as a treating therapist going in and just talking with the patient after they fill out their intake form and consent forms, you get a really good idea and a good feel of like what it is that is going on and how to proceed with your care. And then lastly, on the intake form, just like you would on your consent, make sure to include the patient's name, signature, and date that they signed it so that you cross all your I's and dot all your T's. Once again, if you're creating your consent to treat form within Google Forms, I would also encourage you to create your intake form in Google Forms as well. Super simple, easy to get started with. And in the next video, we'll talk a little bit more about like what it looks like to work with something like Google Workspace and why that would be like a good starting place for you, because it is HIPAA compliant. Like there's a business version of it that's super cheap on an annual basis and allows you to get started with some of the really important like back end things that you need to take care of as far as like your intake and consent to treat forms so that you're covered when you go to treat your patients. I hope this video was helpful. Really, like what I wanted to get across is that there are just some things we have to do to protect ourselves as a business owner and as a practicing provider for a business. And those things specifically would be professional liability insurance, consent to treat forms, and intake forms. And that will get you started as far as like getting to see your patients. Stay tuned for our next video, and we're going to talk more about the techie things and really what you need in order to start a virtual pelvic health practice. When it comes to the tech setup and seeing patients and what that looks like, it's really, once again, not as challenging as you may think. You probably already have all these things in your home. Anyways, go ahead and hit the like button, subscribe to my channel if you are interested in more content that I'm putting out, and I will see you guys in the next one.